Well, good afternoon, everyone. Welcome back to the Kapner Research Council webinar series. As you may recall, we started off the CRC webinar series as an in-person coffee and conversation before the pandemic. Dr. George Smith, Mizzou's own Nobel laureate, was the inaugural speaker. Well, we changed our format to a webinar following campus shutdown back in the spring of 2020. We really would like to bring the coffee and conversation format back, but we have decided to wait until spring. Today is our first webinar of the fall semester, and we have one of our newest faculty members, Dr. Kantha Channaiah from the Division of Food, Nutrition, and Exercise Sciences as our speaker. Dr. Mengshi Lin, professor from the same division and a member of the Kapner Research Council, will make the formal introduction. But before he does so, I would like to say a few words about the Kapner Research Council. We formalized the CRC about 2.5 years ago as an advisory council that would provide advice to my office, that is the Office of Research. We do have faculty from every division represented on the council. We also have representation from staff, graduate students, and postdocs, and even the Missouri Ag Experiment Station. This webinar is an example of some of the activities of the council, in addition to providing advice on critical issues to my office. CRC also helps me in making important decisions. And when they do so, they are representing you, our faculty, staff, graduate students, and postdocs. In other words, CRC plays an important role in shared governance in our college. Before I hand over to Dr. Lin, let me remind everyone that you need to post your questions in the Q&A box, not in the chat room. Dr. Felix Fritschy, chair of the Kapner Research Council, will be moderating the Q&A session in the end, and he will try to repeat the questions. So without further ado, Mengshi, the floor is yours.
Hello, everyone. I'm Mengshi Lin. I'm delighted to introduce Dr. Channaiah. Dr. Channaiah currently is working as an assistant professor and a state extension specialist, food processing and safety in the Division of Food, Nutrition, and Exercise Sciences. Kantha obtained his PhD from Kansas State University with specialization in food safety microbiology. After graduation, he worked as a postdoc, research associate, instructor, and manager of the microbiology and toxicology research laboratory at Kansas State University. Kantha worked as global director of microbiology at AIB International for 8 years. Before joining Mizzou, he has over 17 years of experience, which is quite impressive, in various fields such as food microbiology, biotechnology, consultant for food, beverage industries, HACCP, GMP, FSMA, regulatory compliance, process validation, and environmental monitoring programs. Now I'd like to hand over to Kantha. It's all yours. Kantha, you can get started.
Yes, thank you, Dr. Lin, for the introduction. Thank you, Dr. Lin. Good afternoon, everyone. Today, I'm excited to talk about validation of the baking process as a kill step for controlling Salmonella and other important foodborne pathogens. Following is the outline of my presentation today. I will begin my presentation with the introduction, followed by importance of bakery product food safety, key FDA FSMA validation requirement, baking kill step validation research. Then I'll talk about the baking thermal process lethality model, or we call it as calculators. Then I'll talk about the benefits of KSV research. And finally, we will finish off with a QA session. Also, please note that throughout the webinar, I'll be using an acronym KSV, which stands for kill step validation. Let me start with an introduction. There are nearly 3,000 commercial bakeries and 6,000 retail bakeries operate in the US with a market value of more than $30 billion per year. The US baking industry, comparatively, when you compare with the other industries such as fruit processing or meat processing industry, has a very safe record for the production of shelf-stable processed food products. However, like any other food industry, any other food segment, microbiological spoilage has often been the major factor limiting the shelf life of the bakery products, leading to huge economic losses. Although not directly related to production practices, there were 4,200 illnesses associated with the bakery products reported in the US between 1998 and 2007. Additionally, these outbreaks undermine consumer confidence in affected products and diminish market demand, leading to huge economic losses for the food processors. So bakery products, food safety challenges. So let's understand what are the important microbial related food safety challenges associated with bakery products. When it comes to microbial food safety, in majority situation, Salmonella is the main pathogen of concern, and the presence of Salmonella species in bakery ingredients or products could create a public health risk if the product is improperly baked. For your information, any reservoir of Salmonella in finished product is considered adulteration. Okay, so the past research findings clearly show that Salmonella can survive in adverse environmental conditions, including low moisture foods for a long time. Okay, and for this particular reason, it is called a champion of low water food products. Pathogens, including Salmonella, E. coli O121, Listeria monocytogenes, etc., can be introduced into bakery products through a wide variety of ingredients, because most of the time ingredients are the main pathogen of concern, source of concern, such as egg, milk products, flour, milk chocolate, coconut, peanut butter, fruit, spices, list of spices, yeast flavorings, and due to other environmental factors, including human errors. Okay, even though the pathogen is sourced from a very good manufacturer without any bacterial contamination, during the receiving, storage, handling, mixing, things can go wrong anytime. And also it is proven that human error can also lead to cross-contamination and ultimately product adulteration. So, although not common, contamination of finished bakery products results in food recalls, leading to huge economic losses for food companies. Recently, hamburger buns and hot dog buns were recalled due to potential Salmonella and the Listeria monocytogenes contamination. At this stage, I'm not sure what the source of contamination, but at the end of the day, it is the responsibility of the food manufacturer to make sure that the finished product is safe for consumption. So how to make safe? So we're going to discuss in the next slides. So FDA FSMA validation requirements. I'm going to talk a little bit about FDA's Food Safety Modernization Act. So let's understand the regulatory requirement from the US FDA. FDA's Food Safety Modernization Act, or FSMA in short, was the most sweeping reform of our food safety laws in more than 75 years. FSMA aims to ensure the US food supply is safe by shifting the focus to preventing cross-contamination of the food supply rather than responding to it later when the food recalls happens, okay? So according to 21 CFR 117.160, facilities subject to the preventive controls requirement must validate that preventive controls are adequate to control the hazards as appropriate to the nature of the preventive control and its role in facilities' food safety system. In simple, one need to validate all the preventive controls that are process steps and are critical for food safety. Some of the examples include baking, cooking, roasting, boiling, extrusion, okay? Also, FSMA gives FDA the power to scientifically evaluate food safety programs and preventive controls implemented in a food establishment. So that means whenever the FDA inspector steps in, he might ask for the FDA, validation document. So the food manufacturer has to show that, or he has 24 hours to provide the requested document. So this is very important. And previously, it was not a requirement, but post FSMA, it's a requirement. So since validation is very important from FSMA as well as food safety, I partnered with industry stakeholders to develop the kill step validation procedures for various bakery products. When I started doing this research almost 8-9 years ago, there were no records, no scientific literature were available, although so many validation related peer-reviewed articles exist for meat processing, produce, etc., but none were available for bakery products. So the three main goals were, number one, is to develop kill step validation procedures for various bakery products. Number two, provide documentary evidence, that means publish case with research findings for the benefit of bakery industry's food safety needs. And number three is develop a product-specific baking process thermal lethality calculators. For your information, the validation can be complied in three ways. One is mimic the whole process in a third-party biosafety level 2 lab with the pathogen of concern, conduct the microbial challenge study, prepare the report, and keep the file in HACCP file, and that will comply the requirement. Number two is, if there is already a peer-reviewed publication, we can just print that peer-reviewed articles and keep it in the HACCP file. That will take care of the validation requirement. Number three is, one can use validated thermal process lethality models, and the report can be used to provide a documentation of validation of that particular product and process. So these are the three options. So we try to do all the three through this research. So now I will discuss my first baking validation research project titled Validation of Baking as a Kill Step for Salmonella in Hamburger bun manufacturing and evaluation of Enterococcus faecium ATCC 8459 as a non-pathogenic surrogate. So in the first study, we wanted to see how the baking can control Salmonella in case pre-baking contamination happens, and can we use Enterococcus faecium, which is a non-pathogenic and can act as a surrogate in place of Salmonella for in-plant validation verification purposes. So I call this as a foundational research project. For this project, we chose Hamburger bun manufacturing as the model to develop a scientific validation procedure. We chose this because it is one of the most popular bakery product consumed in the US and in Canada. So research objectives, number one is to validate the baking process as a kill step in controlling Salmonella. And number two is validate the baking steps effectiveness in reducing Enterococcus faecium to determine whether we can use this as a non-pathogenic surrogate. And number three is determine the heat resistance, that is D and Z value of Salmonella species and E. faecium in Hamburger bun dough. Materials and methods. We optimize the kitchen oven to bake the hamburger buns, and after a series of trials, we determined that 13 minutes is the optimum baking time at 425 degree Fahrenheit. And we collected samples at 9, 11, 13, and 13 plus 30 minutes cooling phase. The initial microbial population, that is Salmonella, Enterococcus, concentration of 6 to 7 log were maintained in the flour and dough. And after both the proofing and baking, the bacterial concentrations were determined to confirm a minimum of 5 log kill. So microorganisms used in this research. In this research, we used Salmonella typhimurium, the most prevalent food-associated reservoir since 1997, and Salmonella Newport, the third most common reservoir associated with the foodborne disease outbreaks, and the Salmonella Septemberg 775W, a notable heat-resistant, in fact, the most heat-resistant reservoir in liquid culture media and in high moisture foods. To validate in-plant food safety processes without risking the facility, we used Enterococcus faecium NRRL B2354 deposited as ATCC 8459. And also we tested the Salmonella Enterococcus faecium in this study, and it was very clear that it did not possess any virulence or antibiotic resistancy. That means, if everything is working out as per the plan, we can use this as a non-pathogenic surrogate. So that was the overall idea. So flour inoculation, since flour is the main source of contamination and also the most important ingredient, we inoculated trays containing flour with a known concentration of Salmonella and later dried in an incubator until they returned to pre-inoculation dry weight. So here 2 trays of flour containing 400 grams each were mist inoculated. And this inoculation procedure was conducted within a class 2 type A2 biosafety cabinet. And after 5 minutes, trays of inoculated flowers were placed into a 37 °C incubator until they returned to pre-inoculation dry weight. The inoculated flour was stored at ambient temperature for 36 to 48 hours prior to use. In most validation study, we have to give time for the stabilization. You inoculate particular product ingredient and directly expose to the heat, which is not correct. Because we need to provide time for the bacteria to settle down, establish, and then you go for a challenge study or heat treatment or any other lethal treatment. So that's why we followed this procedure. And this is how we conducted the experiment. The flour was mist inoculated with Salmonella, added the other ingredients, mixed with the Hobart A200 mixer, and we followed the procedure. I'm not a baking expert, but we had baking support at AIB. And dough balls were molded into compartments of a grease bun pan and proofed for 60 minutes. And thermocouples were inserted before baking and finally baked at 425 degree Fahrenheit for 13 minutes. And Salmonella Enterococcus were enumerated using selective and injury recovery media. Results, the figure 1. This graph, as you can see, shows the population of Salmonella and Enterococcus enumerated using a selective media at various stages during bun baking. As you can see, the initial inoculum of all the 3 microorganisms were close to 7 log or 10 million cells. And you can see here, I hope you can see the cursor here, in the flower and Dow pre-proof and, post-proof. The population of the Salmonella, Enterococcus faecium, did not change significantly. So it remained, almost like a 6 to 7 log or, above 7 log. And once we started the baking, baking 30 minutes was the standard baking time for this product. And as you can see here, Salmonella were completely gone by 9 minutes of baking. Only the Enterococcus faecium survived. And this clearly shows that, the Enterococcus faecium is more heat resistant compared to Salmonella. And by 30 minutes of baking, even the Enterococcus faecium is completely gone from the picture. And because we wanted to see the 30 minutes cooling time after the standard baking time. So the reason is, even the burns are out from the oven, it's still, the thermal lethality is still happening. The temperature is more than 250 degree Fahrenheit or 300 degree Fahrenheit. So the lethality still happens. So we want to see, what's the lethality during that time, in case if there is still bacteria present, post oven exists. So that was the overall idea. So figure 2, here we used the injury recover media. This graph shows the population of Salmonella and Enterococcus enumerated using injury recovery media at various stages during unbaking. The purpose was to see the recoverability of injured cells, as injured bacterial cells can survive upon availability of favorable conditions. So that was the overall idea. And as you can see, when we compare with the selective media, we observed almost similar pattern of survivability using the injury recovery media. And here also you can see that E. faecium survived a little bit, compared to the previous slide, but Salmonella were completely gone. Yeast were completely gone. Yeast were like very sensitive. I think I would say 60 degrees Celsius, yeast were completely gone. So microbial kinetic studies. So now we know that the E. faecium is showing a more heat resistance compared to Salmonella. We wanted to do the microbial kinetic study using a thermal death time disk. And the microbial kinetic study was conducted to determine the thermal resistance pattern of Salmonella and Enterococcus during baking. And here we used both selective as well as injury recovery media. And from this table, it is clear that D value of Enterococcus is much higher compared to Salmonella. And also the Z values of both Salmonella and Enterococcus are pretty close to pretty close in number. So you can see here, for example, the D value, the time required at a constant temperature to bring down 1 log reduction of Salmonella or E. faecium. So that's called D value. As you can see here at 61 degrees centigrade, Salmonella requires 3.14 minutes, but at the same time, E. faecium requires 14.72. That means, we need more heat, more kill time for E. faecium compared to Salmonella. So this is the comparison we wanted to identify through microbial kinetic study. And the data clearly shows that E. faecium is way much higher heat resistant compared to Salmonella. So highlights. So for the first time, there is a scientific proof that a normal baking process can reduce Salmonella population by more than 6 log CFU per gram. So usually, the food industry, 5 log is the industry standard, the magic number. But for your information, the FDA does not say that you have to achieve 5 log for these type of products. And it has to be based on the risk assessment of your overall product, ingredients, environment. So you have to come up with your own log reduction. But at the end of the day, it's your responsibility. I mean, if the manufacturer, it's the responsibility of the manufacturer to make sure that the finished product is safe, protecting the consumer's health. Okay. So the E. faecium demonstrated greater thermal resistance compared to Salmonella species. And considering the internal temperature versus time recorded in this study, it is clear that all the Salmonella cells were destroyed within the 9 minutes. That means prior to the optimum baking time studied in this research, and greater survival of EFCM during the bun baking and higher D values of EFCM compared to that of Salmonella, the main pathogen of concern in this study, suggests that EFCM can be used as a surrogate for Salmonella species for baking studies in processing facilities if needed. I don't recommend in-plant validation using EFCM, but at least we have a data to prove that EFCM can be used as a non-pathogenic surrogate. So one need to have some extra care in case somebody wants to do an in-plant validation, because if there's some little bit of cross-contamination, it will lead to, although not a food safety hazard, it can lead to a lot of environmental contamination. So we have to be very careful. So additional bakery product validation research, there are more than 2,000 bakery products in the market, and pathogenic bacteria behaves differently at varying moisture levels, pH, fat, or sugar content, right? So for example, Salmonella has shown the highest resistance in low water activity and high fat foods. So each product is not of same food matrices, same ingredients. It has different pH, water activity, moisture content, and other factors like fat, sugar, all those factors. So these are different, and bacteria definitely behaves differently. So we need to validate each product. So that's the rule of thumb. So furthermore, it is important to publish the additional baking validation research finding, thus providing a documentary evidence for the benefit of baking industry's food safety need. So the reason why I want to publish means, the small and marginal bakers or food processors cannot afford the microbial challenge study or validation study in a third-party lab cost. So usually the cost is like, $20,000 to $25,000 per product and per pathogen. Again, it depends on the various factors. So hence it is important to publish this research so that, it helps the majority of the bakers around the world. Hence, it is necessary and valuable to conduct additional validation research involving multiple baked goods categories with varied moisture content, pH, water activities, etc. So far, we have completed nearly 12 products, various bakery products, and published 8 baking validation studies in various peer-reviewed journals. I hope that this is useful to small and the medium scale, the bakers, and also it will help the science to understand the behavior of bacteria in different food matrices. So now I'll talk a little bit about the thermal baking process, thermal lethality model. We call them as calculators in short. So the translation of research to commercial applications. So as I said earlier, we did microbial kinetics study to determine the D and Z values of Salmonella. The main purpose is to compare the heat resistance pattern. At the same time, we want to use that data to develop baking kill step thermal lethality models. So the main objective is to provide food manufacturers a science-based validation tool that can be used to demonstrate the effectiveness of a baking process to destroy Salmonella species in a variety of bakery products. So how does it work? These models are based on the D and Z values of Salmonella in a particular product. And these works by using product-specific oven time and temperature parameters to automatically determine the total process lethality for Salmonella in terms of log values. So baking kill step calculators can be downloaded from AIB's website for free and come with the complete instructions and procedures. It is very simple. If you have a calibrated data logging device with the 6 probes, then you can do it yourself. Otherwise, you can just follow the instruction, or you can call someone expertise to help with the validation of that particular product. So these calculators are available in F and C, that means Fahrenheit and degrees Celsius. The idea is to help the global bakers. If somebody wants to export products to America, that means they need to comply the FSMA rules and regulations. In some of the countries, they use degrees Celsius. So I developed the calculators in both degrees Celsius and Fahrenheit. And I'm happy to share that so far more than 8,000 KSV calculators has been downloaded by various food manufacturers around the world. So that's, as I said earlier, we have completed 12 research products and released 10 different product pathogen specific kill step calculators. And so far in the last 5-6 years, more than 8,000 calculators has been downloaded by various bakers around the world. So some of the limitations of KSV calculators. I just wanted to talk about recent updates with the KSV calculators. Recently, the bakers were asking, of course, we have the calculators. Can you please provide more information like specific recipe used in our research, pH, relative humidity, and water activity details? So we updated those information. And also, all these years, we were concentrating mainly on Salmonella because of the cost and time. But there were some requests and there were some recalls because of the flower recalls because of the E. coli, O121, and Listeria monocytogenes, as I showed earlier in my slide. So we are adding more pathogens apart from Salmonella. We are adding E. coli, O121, Listeria monocytogenes. So from now onwards, when we do the research, there will be 3 separate calculators, product pathogen specific calculators for Salmonella, E. coli, O121, and Listeria monocytogenes. I think I missed something here. Just a second. Okay, I did not miss anything. So some of the benefits of kill step validation research. This research helps to manufacture pathogen-free bakery products, assuring greater safety. At the same time, I'm not saying complete safety, because even after the validation is completely implemented in a facility, people need to monitor the post-lethality cross-contamination. So at least, the validation will definitely help to, produce pathogen-free bakery products, assuring a greater safety, and also helps to meet the generally accepted food safety standards, industry standards, as I said, 5 log reduction, because most of the industry, they're asking for the 5 log reductions. So suppliers, consumers, third-party co-packers. So I think it will help them to, achieve that target, and helps in minimizing baking process, optimizing baking process parameters. Suppose, if the baking is achieved, the quality is achieved, well before the actual time, then, the bakers can optimize, and thus by saving a lot of cost, resources, etc. And a substantial savings to the baking industry by avoiding recalls. And most importantly, if you have a validation, it will, act as a good, the supporting documentation in case of, the legal penalties due to foodborne illness outbreak. And at the end of the day, definitely it will helps to retain the consumer confidence and supports a business success. And some of the limitations, of the KSV calculators. So these are product pathogen specific baking process lethality models, hence cannot be used for other products and for pathogens. For example, the hamburger bun lethality model cannot be used for cheesecake. Similarly, the Salmonella hamburger bun model cannot be used for Staphylococcus or Bacillus or Clostridium bacteria. So it is important to review the formulations and baking process parameters before using these models. Also, please note that an independent challenge study is highly recommended for any significant variation in the recipe or pathogen of concern and for varied baking parameters. And please note that, once you do the validation, you need to revalidate every 3 years unless there is a change in the process parameters or any other pathogen of concern. For example, this year I did the validation for Salmonella based on my hazard plan because Salmonella is the main pathogen of concern. So next year, all of a sudden, there is a new bacteria, then for food safety reasons. So then I have to do validation for that particular bacteria. Otherwise, once in 3 years, you have to revalidate and make sure you have the updated file in the HACCP document. So I would like to thank Experimental Baking Lab, AIB International, Manhattan, Kansas, Dr. Mickey Parish and Jenny Scott, Senior Advisors, FDA, Dr. Randy Phoebus, Food Safety and Defense Lab, Kansas State University, American Bakers Association, and ABA FTRAC for their help and also funding this project, and Dr. Harsha Tipareddy, University of Georgia, Athens, and Dr. George Millikan, Emeritus Professor of Statistics, for helping with the statistics. So I think that's all I have. Thank you so much for your presence and patience. Now I would like to take any questions related to my talk today.
Wonderful. Thank you very much, Dr. Channaiah, for the interesting presentation. And want to remind everybody, please add your questions to the Q&A. I will also look in the chat for your questions. Great. We have a first question from Sarah Asghari. And she is asking, I think you said that sometimes validations are performed by third-party labs. If so, how fast do the results transfer to the manufacturer to allow them to stop the distribution in the presence of pathogen in the final product?
Okay, that's a good question. And thank you, Sarah, for asking this question. So I would like to correct here. It's not sometimes, in majority of the cases, we have to do the validation study in a third-party lab, mimicking the whole process. Because in most of the cases, we are using pathogens, foodborne pathogens, and it's not recommended, it's not legal to carry pathogens into the food processing environment where the human food products are manufactured, right? For example, if I'm manufacturing muffins, I will call someone in food science department or any third-party private lab. Okay, Salmonella is the main pathogen of concern. Can you mimic the whole process in your lab and give the results? Usually it depends on the time. And if it comes to my lab, I have to consider all the other activities like teaching, extension, and the student helpers, PhD student, we need to take care of their course and all those things. Usually it takes like 2 months to complete everything. But in majority of the cases, the maximum time will go identifying the worst case scenario. Okay, suppose if we are mimicking the same, for example, muffin in my lab, because I'm not a baking specialist, I need to do some trial and error to make sure that, it matches the quality parameters of the company, third-party company, etc. So it's going to take some time. And also, for example, if the company says, we are baking it at 375 degrees Fahrenheit for 10 minutes, then we have to think of the worst case scenarios. What if the temperature is just 365? Can the product still achieve the 5-log reduction? And what if the baking time is less than 10, which is 9 minutes or 30 seconds or 8 minutes or 50 seconds? Will that still sufficient to achieve the the food safety parameters? So all those worst case scenarios we need to think. Then we have to design the experiment and execute, and writing the report in a standard format, almost like writing a manuscript. And if they want, we can publish. Otherwise, it will we have to submit it as a confidential report. So usually it takes like 2.5 months. Again, depends on the pathogen and the product complexity. I hope that answers your questions.
Thank you very much, Sarah. If you want to follow up, just type it into the Q&A and we can follow up. In the meantime, we have a question from Mengshi Lin. How resistant is Salmonella to the low water activity foods? Do the lethality models and kill step validation investigation in bakeries contain different food ingredients?
Yeah, I think that's a great question. So far in the last 20, 30 years, the research done by other researchers around the world clearly show that, Salmonella is the main pathogen of concern, and it has the unique ability to modify its cell and, go into a dormancy when there is a less water. And the most tricky part is as we decrease the moisture, the heat resistance capacity of Salmonella increases. So far, this is the most important pathogen for low moisture foods and low moisture environment. I'll give you an example. In one of the cereal manufacturing company, there was an outbreak, and and after that, they went through a lot of product change, sanitation, cleaning, and everything, and they changed the product. And after 8 years, there was again a recall contamination from that particular company. And the FDA folks, when they got into the facility, they could isolate the same serovar, same strain of Salmonella. And obviously, bacteria are here on this earth for so many thousands of years. So that means they are more resistant, and particularly Salmonella is the most heat resistant, particularly for low moisture foods. And definitely that's the reason I said there are more than 2,000 products in the market. And it's a big challenge because, suppose if I'm a food manufacturer, all these years I'm getting my ingredients from Mexico, and if I change that to China or India or Australia, then the things can differ, right? The raw ingredients coming from different countries, we have to understand the risk parameters. So every time you change the major ingredients, baking process parameters, sugar and fat are very important. That's why I said, like, any significant change in the formulations, please, you have to go for your own independent challenge study. Don't just use the model. So in case any variation in the ingredients, you have to do that. But unfortunately, that's how it is. And we cannot have just one formula, one model for all the products. That means we will not have any work as a researcher. So that means, that's what it is. So that's what the science, that's why we need more research, more scientific investigation.
Thank
Good
you.
answers. Very informative. Thank you.
I'd like to follow up on that. I think is a very interesting topic. And I guess I'm trying to understand a little bit the mechanisms underlying the reasons why there is different kill durations or temperatures if the composition changes. Let's say the fat is different. Is there a potential, how does that translate into greater survival? Maybe let's say it's greater survival mechanistically. Is it a function of the actual temperature measured by the thermocouple, or is it metabolic, related to the metabolic aspects of the Salmonella, for instance? Can we explore the mechanisms to have a more fundamental mechanistic model that can predict multiple scenarios?
Sure, sir. Sure, Felix. I think that's a great question. In fact, I'm working with the FDA, and for the last 5-6 years, and we are pulling all the data generated in the last 10 years, and from, I think I'm the only one who did so many products, particularly for the bakery products, but now others are also doing. But we are trying to pull all the data and trying to understand, like, which is the most important factor, that affects the process lethality, particularly for Salmonella. Unfortunately, there's so many other variables, some of the variables, visible variables, non-visible variables. So sometimes, things can go wrong. I'll give you an example. Suppose, the baking product, the small bakers, medium scale bakers, large scale bakers, right? And, the number of products on the oven belt, definitely it matters, because the moisture ooze out of each product. It creates a relative humidity. And FDA recently, they asked me to, study the impact of relative humidity in that particular room where the product is being manufactured, because according to them, relative humidity has a more lethal impact. I totally understand, but how to measure the relative humidity? That's another challenge. In fact, in one of the meeting, they asked me to, study the relative humidity. But unfortunately, once the temperature crosses 100 degrees Celsius, the measuring relative humidity makes no sense. Okay, the definition clearly says that you can measure the relative humidity below 100 degrees Celsius. But in most of the bakery products, it's more than 100 degrees Celsius. But still, we are trying to add more parameters and make it a robust model. That's the process, that's the investigation we are still doing. And also I'm continuing some of my, that's one of the priority in my lab. So I'll be adding the, the more research parameters, variables, particularly relative humidity, and see how it impacts. In my opinion, if the temperature is like, 170, 180, then relative humidity will have a huge impact. But in this case, the temperature is, at least so far what I've studied, the temperature is more than 400 degree Fahrenheit or 350 degree Fahrenheit. In most cases, it's like, few minutes, instant death. But still, we have to be careful, all these years, we never thought of COVID, something right? So it came and, it stopped the whole world, starting from 2020. So we have to be very careful. That's why the FDA says you have to revalidate if there is any significant change in the process parameters. Our new machine, okay, I plan to change into a new machine. Recently, I helped for a company. They changed, I cannot disclose the information, but instead of regular conventional oven, they're using different sources of energy to cut the production time. So usually, for example, particular product, I'll get tempted to reveal the information. I don't want to reveal that. So that product is, suppose it takes like 10 minutes baking. They're using new technology where it bakes only in like a couple of minutes. In fact, it's seconds.
Wow.
So you can imagine, the technology change, and definitely we need to validate, particularly for Salmonella or any other bacteria. So any new invention, innovations, new technology, new parameters, corn syrup versus regular syrup, cane sugar, sugars versus pineapple sugar. There are so many other sources of sugars, right? And definitely fat and all those ingredients, definitely, we have to be very, very careful. That's why we always said, do a thorough risk analysis, then everything will be, simple.
Yeah, that makes a lot of sense. It's a giant matrix of possibilities, I guess, that can influence it, right?
Yeah, the size also matters. The number of products on the belt also matters. Right. Sometimes because of the production, there are so many practical issues with the bakers, food manufacturers. So it's not producing, for example, 20 per line instead of 20, it's producing only 10. So then the heat distribution is different. Right. The heat wave is different. And some of the burners are not working, it's not uniform. There's so many issues, and particularly the small and medium scale food manufacturers, they have a huge challenge to have the validation in place.
All right, well, thank you so much. I don't see any more questions, and I think we're getting close to the end of our time anyway. So thanks again, Dr. Channaiah, very interesting.
And thank you so much for the opportunity. And in case any questions, please email me. I'll be more than happy to answer. At the same time, I want to learn.
All right. Well, thank you again. And I'll turn it over to Dr. Jose.
Well, thank you, Felix. And Kantha, very fascinating work. We often take food and food safety for granted, but thank you for keeping it safe for us. So I know everyone can appreciate and understand the value of the line of research that you are involved in. And thank you for sharing that with us. We appreciate it very much. Well, so we do have another seminar that is coming up on the 11th, that is next week. So our speaker will be Dr. Jordan Wade, a new faculty member from the School of Natural Resources. He will be talking about soil health and an exciting program that he is building here at the University of Missouri in Kapner, and trying to make us the national leader for soil health research and outreach. So, well, let me also thank all of you who participated in today's webinar. I will see you next week then. Thanks, everyone.